Tonight, Senate Republicans considering a plan to address a spike in health care costs.
It has been nearly a month since the federal government shutdown ended, with the promise from Senate Republicans to consider extending health insurance subsidies. We've got team coverage. Kevin Dorn breaking down what it could cost you.
First, our chief political reporter Tom Hauser is here to explain what Republicans are voting on tomorrow. Tom.
Yeah, and billions of dollars in taxpayer funds are at stake, along with health care premiums. The December 15th deadline, just 5 days away to apply for health insurance, starting on January 1st. Tomorrow, the U.S. Senate will vote on bills that could impact how much people will pay for insurance in the public health insurance market. The cost of health care leads to rising health insurance costs. But so will a lack of action by Congress to extend health insurance subsidies.
In 2026, if the federal government doesn't extend these enhanced tax credits, the government will still provide some financial help, but it will be less than it has been in these last few years.
Republicans can't kick this problem down the road to January.
Minnesota Senator Amy Klobuchar supports a Democratic plan to extend the existing tax credits people rely on to keep health insurance affordable.
They're seeing that their premiums have doubled and tripled. They are weighing what this means for their families. Should they have no plan? Should they get a junk plan? Should they stay in a job when they actually want to go start a business?
A Republican plan would give money directly to people with qualifying incomes to create new health savings accounts to help pay out-of-pocket expenses. It has the support of President Trump.
I want to give nothing to the insurance companies, but we want the money go directly to the people. We want you to go out and buy your own health insurance, and you'll get much better health insurance at a much lower cost.
Regardless of whether Congress takes any action, MNsure CEO Libby Callum says Minnesotans should not consider giving up and not buying any health insurance.
Having health insurance can protect you from catastrophic financial situations, and it helps make sure that you can stay healthy through the year.
Now, Senate Majority Leader John Thune says he doesn't think either the Republican or Democratic plans will get the 60 votes needed to pass. Meanwhile, Republican House Speaker Mike Johnson says the House might have its own plan to vote on next week, but that also seems like a long shot to pass. Paul?
Okay, Tom Hauser, thank you. Now, as Tom just reported, both plans to be considered tomorrow in the U.S. Senate will likely fail.
So what will it mean for Minnesotans if Congress does not extend health insurance subsidies? Kevin Dorn now in the newsroom. And Kevin, you're taking a look at who this impacts and what's at stake.
Yeah. It impacts a lot of people. Affordable Care Act healthcare subsidies are used by more than 20 million Americans, and those subsidies were enhanced or increased during the COVID pandemic. But those higher subsidies expire at the end of this year. Here's a look at the situation in Minnesota. According to MNsure, the public health insurance marketplace, many Minnesotans will continue to get smaller subsidies. But about 90,000 people will see higher premiums without those enhanced federal subsidies. And 19,000 will lose all federal subsidies because they will no longer qualify under new income limits. Starting in 2026, Minnesotans earning more than $62,600 a year as single taxpayers, or $84,600 for married couples, will not qualify for any tax credits. So there's a lot at stake when the U.S. Senate votes on those competing plans tomorrow. Health insurance costs could be a major issue in the 2026 elections.
There's a lot of public insecurity about health insurance because costs have been going up in recent years. So Democrats are politically smart to try and emphasize that issue, and Republicans have to find a way around it.
And I know I just threw a lot of numbers at you, but to help you navigate all this, we have links to MNsure and other resources right now at KSTP.com.